Look down at your feet right now. Go ahead. Actually, look at them. Because what you are about to learn in the next few minutes might be the most important thing you have ever been told about your health. And it starts at the very bottom of your body, in a place most people never think to examine. Your feet are not just the part of your body that carries you from room to room. They are one of the most sophisticated early warning systems in all of human biology, and they have been trying to tell you something that your annual blood test might have completely missed. Right now, today, there are 9 specific signs that can appear on your feet, between your toes, on your soles, around your ankles, and in your toenails that medical research has confirmed are directly linked to one of the most dangerous and rapidly spreading diseases on the planet, a disease that currently affects over 500 million people worldwide. A disease that destroys kidneys, blinds eyes, causes heart attacks, and leads to amputations. A disease that in many cases is progressing silently for 10 to 15 years before a single conventional symptom appears. But your feet know. Your feet have been showing the signs, and most people look at those signs every single day and have absolutely no idea what they are seeing. Stop everything, because sign number 7 on this list is the one that most people have had for years and have never once connected to what may be happening inside their body right now. Let's begin with why feet specifically reveal what is happening with blood sugar and metabolic health, because this is not arbitrary and it is not folklore. It is grounded in specific, well-understood physiology that makes the feet uniquely positioned to display the earliest evidence of the damage that elevated blood sugar causes throughout the body. Your feet are the furthest point from your heart in your entire circulatory system. The blood vessels supplying your feet are among the smallest and most delicate in your body. The tiny capillaries that thread through the skin, the nerves, the muscles, and the connective tissue of your feet are at the very end of a long, complex delivery chain. When something begins to damage your circulatory system or your nervous system, as elevated blood sugar does consistently, progressively, and with devastating specificity, the damage shows up earliest and most severely at the extremities, at the ends of the longest nerves, at the tips of the smallest blood vessels, at the feet. Diabetes damages the body through 2 primary mechanisms that operate simultaneously and reinforce each other. The first is neuropathy, damage to the nerves, beginning with the longest nerves that supply the feet and lower legs. The second is vasculopathy, damage to the blood vessels, beginning with the smallest capillaries and eventually involving larger vessels as well. Both of these processes begin long before blood sugar reaches the diagnostic threshold for diabetes. They begin in what is now called prediabetes, a state of metabolic dysfunction that affects over 1/3 of adults in many countries, and that the vast majority of people in that state are completely unaware of. And they both announce themselves, if you know how to look, through specific recognizable changes in the appearance, sensation, and behavior of your feet. The first warning sign is one that almost everyone has experienced at some point and almost everyone has dismissed as completely normal. Tingling, burning, or a pins and needles sensation in the feet, particularly in the toes and the ball of the foot, and particularly noticeable at night or when you are sitting still. Most people who experience this attribute it to sitting in an awkward position, to their shoes being too tight, or to something they vaguely label as poor circulation and then promptly forget about. But when this sensation is persistent, when it returns night after night, when it appears in both feet simultaneously, when it wakes you from sleep, it is no longer a random inconvenience. It is a specific neurological signal with a specific biological cause that you cannot afford to ignore. What is happening is this. Elevated blood sugar, even at levels that have not yet crossed the diagnostic threshold for diabetes, damages the myelin sheath, the protective coating around nerve fibers, through a process called glycation. Sugar molecules attach to the proteins in the myelin sheath and alter its structure, impairing the ability of the nerve to conduct signals accurately and reliably. The result is a misfiring of sensory signals, your nerves sending sensation messages when there is nothing there to cause them, or distorting genuine sensations into burning, tingling, or electrical feelings that have no external cause. This is called peripheral neuropathy, and the fact that it begins in the feet and progresses upward along the legs is so consistent and so characteristic that neurologists refer to the distribution of symptoms as the stocking pattern, as if someone were pulling a stocking of neurological damage progressively higher up the leg. The second warning sign is the opposite sensation, numbness or a reduction in the ability to feel temperature light touch, or pain in the feet. This is in many ways the more dangerous of the two presentations, because while tingling and burning at least generate symptoms that demand attention, numbness removes the protective pain signals that would normally warn you of injury. People with diabetic peripheral neuropathy and the numbing pattern frequently sustain injuries to their feet, cuts, blisters, pressure sores, burns from hot water or surfaces without feeling anything at all. A small cut that would normally be felt, treated, and healed becomes an undetected wound that festers, becomes infected, and in the context of the poor circulation that accompanies diabetic vascular disease, fails to heal. This is the cascade that leads, in its most advanced form, to the lower limb amputations that represent one of the most devastating and yet most preventable complications of poorly managed diabetes. The third warning sign is changes in the skin of the feet, specifically a phenomenon called diabetic dermopathy that manifests as light brown, slightly scaly patches appearing on the shins and the tops of the feet. These patches are sometimes called shin spots, and they result from changes in the small blood vessels of the skin that reduce its ability to regulate temperature and maintain its structural integrity. They are often attributed to normal aging, to minor injuries, or simply to dry skin, and they are dismissed accordingly. But in the context of other symptoms, diabetic dermopathy is a highly specific marker of chronic microvascular damage. The skin of the feet is literally showing you that the smallest blood vessels in that area have been structurally compromised by prolonged exposure to elevated glucose. Related to this skin change, but distinct from it, is extreme dryness and cracking of the skin of the feet, particularly the heels, which represents the fourth warning sign. The autonomic nerves that regulate sweat gland function in the feet are among the earliest casualties of diabetic neuropathy, and when these nerves are damaged, the sweat glands in the feet reduce or cease their activity. The result is profoundly dry skin that cracks, particularly at the heels, forming deep fissures that not only are painful, but create entry points for bacterial and fungal infection. Most people who develop severely dry, cracked heels attribute it to dehydration, to not moisturizing enough, or to walking barefoot. And while all of these factors contribute to heel cracking in general, the pattern of dryness that results from autonomic neuropathy has a specific quality. It is severe, persistent, resistant to moisturizing, and typically bilateral, affecting both feet approximately equally, that distinguishes it from ordinary dry skin when you know what to look for. The fifth warning sign is changes in the appearance and health of the toenails, specifically a pattern of thickening, discoloration, brittleness, and separation of the nail from the nail bed that many people immediately attribute to a fungal infection and treat accordingly, often without success, because in many cases the underlying cause is not fungal at all. Reduced blood flow to the nail matrix. The tissue at the base of the nail that generates new nail growth causes the nail cells to receive insufficient oxygen and nutrients. The result is nails that grow abnormally slowly, that thicken as the nail layers are produced more slowly and stack up, that become yellowish or brownish in discoloration, and that in some cases begin to separate from the nail bed in a way that creates the dark gap beneath the nail that most people immediately assume is fungal. Now, fungal nail infections are indeed more common in people with diabetes because elevated blood sugar creates an environment in which fungi thrive. So the attribution of nail changes to fungal infection is not always wrong. But the significant point is that even when fungal infection is genuinely present, its presence in a person with the pattern of nail changes described above, combined with the skin changes, the sensory symptoms, and the other warning signs on this list, should prompt a much deeper investigation than simply purchasing an antifungal treatment and moving on. The nail is a window. What you see in the nail is a reflection of what the blood supply to that tissue looks like, and abnormal nails are telling you something specific about the vascular health of your feet. The sixth warning sign is swelling, edema, in the feet and ankles, particularly swelling that appears at the end of the day, that leaves an indentation when you press a finger into it, and that seems to fluctuate without obvious explanation. Swelling in the feet and ankles has many causes, and not all of them are diabetes-related. Heart failure, kidney disease, venous insufficiency, and certain medications all cause peripheral edema. But in the context of diabetes and prediabetes, edema in the feet and ankles reflects a specific combination of vascular damage and kidney dysfunction that is worth understanding. Diabetic nephropathy, kidney damage caused by prolonged elevated blood sugar, impairs the kidney's ability to regulate fluid balance, causing fluid retention that preferentially pools in the lower extremities due to gravity. Simultaneously, damage to the small veins and capillaries of the legs impairs the return of fluid from the tissues back into the circulation. The combination produces swelling that is persistent, often worse toward evening, and accompanied by a heaviness or tightness in the lower legs that is not fully explained by activity level or diet alone. The seventh warning sign, the one that was mentioned at the beginning as the sign most people have had for years without connecting it to their metabolic health, is slow healing wounds, cuts, or sores on the feet. This is the warning sign that most commonly goes completely unnoticed for the simple reason that most people do not regularly examine the soles of their feet, the spaces between their toes, or the areas around their heels with any attention or intention. A small cut or blister occurs. It takes weeks to heal rather than days. It scabs over and then reopens. It seems mildly inflamed in a way that doesn't resolve, and the person notices it vaguely, considers covering it with a bandage, and assumes it is just taking a while. They never connect it to the fact that their blood sugar has been running slightly elevated for years, that the microvascular damage to the tissues of their feet has reduced oxygen delivery to the healing tissue, that the elevated glucose in their blood and tissue fluids is impairing the function of the immune cells that should be fighting infection, and that the peripheral neuropathy reducing their sensation means they are less likely to protect the area from further trauma while it struggles to heal. This pattern, delayed healing, recurrent infection, failure of wounds to close in the expected time frame, is one of the most diagnostically significant early markers of diabetic vasculopathy. The tissue repair process requires precisely coordinated activity from the immune system, the circulatory system, and the nervous system, and diabetes impairs all three simultaneously. The result is a wound healing capacity that is measurably, specifically, and in some cases catastrophically reduced compared to what it should be. And the feet, being the most exposed and most mechanically stressed part of the body, are where this impairment first becomes visible. The eighth warning sign is a change in the temperature of the feet, specifically feet that are persistently cold, particularly at night, that feel cold to the touch, and that warm up only slowly or incompletely with external warmth. Cold feet are extraordinarily common and extraordinarily commonly dismissed, but persistent, bilateral, disproportionate coldness of the feet that is not explained by environmental temperature or by Raynaud's phenomenon represents reduced arterial blood flow to the extremities, peripheral arterial disease, which is one of the most direct and serious vascular complications of diabetes and metabolic syndrome. Peripheral arterial disease in the context of diabetes is driven by the accelerated development of atherosclerosis, the buildup of fatty plaques within arterial walls that elevated blood sugar promotes. The arteries supplying the legs and feet narrow. Blood flow decreases. The feet receiving less blood receive less warmth, less oxygen, less immune protection, and less healing capacity. Cold feet that have been attributed to poor circulation and treated with warm socks and hot water bottles may actually be an early indication of arterial narrowing that, if identified early, can be addressed through lifestyle modification and medical intervention before it progresses to the point of creating non-healing ulcers, gangrene, and the possibility of amputation. The ninth and final warning sign is one that sits at the intersection of the vascular and neurological damage we have been discussing. And it is one that generates enormous daily discomfort for the millions of people who experience it without understanding its significance. Restless legs and painful leg cramps, particularly at night, combined with the specific and characteristic pain of peripheral neuropathy that is worst when lying still in bed. Many people with early diabetic peripheral neuropathy describe a burning, aching, electric, or crawling sensation in their feet and lower legs that intensifies at night when they are trying to sleep. This nighttime intensification is not random. During the day, sensory input from walking, from pressure, from temperature helps to modulate and partially mask the disordered nerve signals. At night, in the quiet and stillness, the disordered signaling from damaged nerves is unmasked, and it can be severe enough to significantly disrupt sleep, which then worsens insulin resistance, which worsens blood sugar control, which accelerates the very neuropathy causing the sleeplessness. It is another of the vicious, self-amplifying cycles that make diabetes so progressive and so difficult to reverse once it gains traction. Now, here is what is absolutely critical to understand about these 9 warning signs collectively. Because the individual signs are important, but the pattern they form together is where the real diagnostic power lies. None of these signs in isolation is proof of diabetes or prediabetes. Tingling feet can be caused by vitamin B12 deficiency. Swollen ankles can be caused by venous insufficiency or heart conditions. Slow healing can be caused by immune dysfunction from other causes. Toenail changes can be purely fungal. Any single sign considered alone has many possible explanations, but when 2, 3, 4, or more of these signs are present simultaneously in the same person, particularly when they appear together in a pattern that involves both sensory changes and skin or nail changes and circulatory changes, the probability that something significant is happening metabolically becomes very high indeed. Your feet are telling a story. They are telling it with the language of tingling and numbness, of dry cracking skin and abnormal nails, of slow healing and persistent coldness and nighttime burning. And that story, taken as a whole, is one of the most powerful early warnings available about what may be happening to your blood vessels, your nerves, your kidneys, and your metabolic health across your entire body. The most important thing you can take away from everything discussed here is this: the window of opportunity in diabetes and prediabetes, the period during which lifestyle intervention can prevent, reverse, or dramatically slow the disease, is vastly larger than most people realize, but it is a window that only remains open if you act on the early signals your body sends. By the time conventional diagnostic tests detect blood sugar elevations severe enough to qualify as type 2 diabetes by current medical criteria, significant microvascular and neurological damage has frequently already occurred. The feet, examined carefully, taken seriously, and connected to the broader pattern of your health, can give you years of warning that no blood test would have caught. Look at your feet differently from this moment forward, not with anxiety, but with attention, with the understanding that they are connected to everything, to your circulation, to your nervous system, to your metabolic health, to your risk of heart disease and kidney disease and neurological damage. When something changes in your feet that doesn't make immediate sense, when healing seems slow, when sensations seem wrong, when the skin or nails seem different from what they should be, take that seriously. Get it checked. Ask specifically about your blood sugar, your hemoglobin A1C, your fasting insulin. Advocate for the investigation that might catch something that could genuinely and meaningfully save your life. So here's the question I want you to answer honestly in the comments, because your experience matters and what you share might be the thing that motivates someone else to make an appointment they have been putting off. How many of these 9 warning signs have you noticed in your own feet, and how long have you been dismissing them as something else entirely? Write your answer below, because you might be giving someone reading these comments the courage to finally take their feet seriously.